do you have pain when sitting for a long period of time, running or playing sports, and it's not jumper's knee? It could be patellofemoral pain syndrome or Osgood Schlatters disease. We're going to break down the differences and best ways to rehab those injuries. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. Let's jump into it. All right, guys, so Osgood Schlatters disease and Patellofemoral Pain Syndrome, even though they're different, they actually are very similar in their presentation. So both of them, you're gonna have that pain around the front of your knee when you're sitting for a long period of time, after playing sports, while playing sports, or when you're going downhill, down the stairs. And people sometimes say like, hey, it's all over my kneecap. It's kind of diffuse, but that they're very similar in their presentation, but they're very unique in the way you treat them and also different little factors. So let's jump into those different little factors. All right, guys, let's break down the difference. So Osgood Schlatters disease, it usually affects more those kids between ages 10 to 15. It's a growing condition and they'll have pain more in that bottom of the kneecap. They'll have that painful bump. It's called a tibial tuberosity. As opposed to patellofemoral pain syndrome, it doesn't discriminate on age. It affects a whole wide spectrum. But if you're over the age of 16, you're probably dealing more with patellofemoral pain syndrome. And patellofemoral pain syndrome just means there's pain around the patellofemoral joint, which is the kneecap joint. But they present fairly similar, like you'll have that pain all over the front of the knee. And when it's very flared up, people will say like, oh, it just hurts all over here. And that's why it's kind of hard to tell and present similar. But the big difference is the age. So if you're younger, you're more likely to be dealing with Osgood Schlatters. If you're older, you're more likely dealing with patellofemoral pain syndrome. All right, guys, so let's break down the injury a little bit more and go into some treatment. So with Osgood Schlatters disease, like I mentioned, it'll have that painful bump. It affects more of that 10 to 15 age group there. And it's more of a growing condition. So as you're growing, these tendons and these muscles are pulling on these bones that are growing, and you'll have that pulling there and those growing pains. So when it comes to treatment for that, we have to treat it differently than patellofemoral pain syndrome. So for the treatment in Osgood Schlatters, we actually encourage some slight rest early on, and then we start encouraging more of that posterior chain loading, then slowly reintroducing some quad strengthening. Because if we do too much that quad strengthening, we're already having some pulling from that tibial tuberosity from those tendons like we mentioned. So if we start strengthening more of those quads, it's going to pull that tendon even more and irritate that Osgood Schlatters even more. So we're really focusing on stretching, some more posterior chain strengthening as opposed to more direct quad strengthening. Versus patellofemoral pain syndrome, like I mentioned, it's pain around that patellofemoral joint, which is the kneecap joint. So when we have that patellofemoral pain, we just have abnormal forces in that kneecap, might lead to some maltracting, some of these abnormal forces. So it's more that biomechanical approach. So because it's a biomechanical approach, there's different factors at play. So for patellofemoral pain syndrome, if we would be doing the same rehab versus Osgood Schlatters, we wouldn't get the same results. They're treated differently. With patellofemoral pain syndrome, we might even look at the ankle, the hip, the knee. So different factors that might be causing these abnormal forces. Could be the weak quads, could be weak glutes, could be limited dorsiflexion. So there's different factors with the patellofemoral pain syndrome. That's why, like I mentioned early on in the video, these two conditions might present the same, but they're treated very differently. Because if you do, let's say, if you think it's weak quads and you go hard on the quad strengthening and it's actually Osgood Schlatters, it might just be irritating your Osgood Schlatters even worse. So we got to make sure, find out what you have, and then from there go into your treatment. And if you're dealing with Osgood Schlatters disease, we have a great online rehab program. Click the description below. It's on our website. But it's a great way for you to just ramp it up slowly on your own pace at home. But these are, like I mentioned, very similar, but you got to treat them differently. If you guys have any questions or you want us to help you with your rehab, we work with people online and in person in Southern California. Send us an email and we'll get you started right away. And if you guys have any questions regarding this injury, comment below. We'll try to answer those questions and share this with friends and family. We are the Basketball Doctors. Let's ball for life.